Tennessee's rural hospitals in crisis. Over the weekend, yet another hospital shut its doors,
opening the door to potentially deadly consequences. Here's News Channel 5's Chris Conti.
When Cumberland River Hospital closed its doors on Friday, it became one of more than a half dozen hospitals that have shuttered statewide in the last few years. And the consequences for these rural communities are deadly.
It's sad. I mean, it's so sad for this community.
If you didn't know better, you thought there was a funeral being held in Clay County today.
Well, it's sad. I was actually born up here in 1972, and it's sad to see it closed down now.
Then again, for Mayor Joey Rich, this essentially was one.
Probably hasn't sunk into everyone yet.
On Friday morning, Cumberland River Hospital became the latest victim in the state's rural health care crisis. 140 doctors, nurses, and staff lost their jobs. The only ER within an 18-mile radius is gone and not coming back.
Feels like you've lost part of your county. It's like there's a big hole up there right now where a hospital used to be.
Natalie Boone is the EMS director for the county.
These two units both have 200,000 miles on them.
They currently only have enough staff to run 2 ambulances. Yesterday, both had to be sent to Cookeville, nearly an hour away, essentially leaving residents with no emergency room and no ambulances nearby.
Life or death. In some of those cases, my fear is it will be death.
Clay County paramedics and EMTs are now the first and possibly only lifeline for residents here.
Thank you, honey.
The impacts, though, reach far beyond the walls of this shuttered hospital.
Something that saves lives to close.
For Sandy Daniels, it will mean a loss of customers at OB River Market.
The hospital usually done a lot of business with us.
She understands the economic impact this will have. She also understands the harder to quantify consequences.
My son, 23 years ago, flew out from up there.
When he was 3 years old, Sandy's son Trent nearly died from pneumonia.
And you want a recent one now?
Physicians at Cumberland River were able to stabilize him so he could be flown to Chattanooga.
And if it hadn't been for this hospital up here, he would have never survived.
In Clay County today, this may not have been a funeral, but they were essentially saying goodbye to a family member.
It may be too late for our hospital, but there's got to be a solution to save these rural hospitals.
Chris Conti, News Channel 5.
Cookeville Regional Hospital managed Cumberland River. The Board of Aldermen in the city said it essentially was losing too much money each year to keep the doors open.